Yep. So
Ted, thank you so much for joining us. I was getting a little nervous because we couldn't find you. So Ted, what we have here are the COVID coordinators from around the state. There are 44 COVID coordinators. Also, Sharon Lee Treffry from the Department of Health, and we have an invitation out for Elisa as well. I'm not sure if she's joined us just yet. And the school nurse liaisons. And I'm not sure, I know that we're expecting Kate to join us as well. So I appreciate you being here. So for the rest of you school nurses, Ted Fisher is, I think your title is actually public relations, am I correct? At the Agency of Ed, Ted?
Policy.
That's
Policy.
correct. Director of Communications and Legislative Affairs.
Okay.
In normal times.
Okay, sorry about mangling that. So I asked Ted to speak with us about this program that many of us have heard about that's going to be rolled out and answer. So what I'm going to have him do first, Ted, is if you would share the program, much like you and I were talking initially when we spoke on the phone earlier today. I think that will give the basis of the background information that folks are going to need. And then we can pose some questions that I know that you've been gathering them, and we have been gathering them as well from the COVID coordinators. I had asked them earlier on to send the questions to the AoE email address that you had shared with me and carbon copy the school nurses, the VSSNA, so we could make sure that we get answers. So I don't want to spend a whole lot of time more because I really know that we're all here to hear from you, and I appreciate very much the stress that you're under. Ted's waiting for a new addition in his family, so I'm just delighted that he's taken time out here for us as well. So I'm going to turn the mic over to you, Ted, and let you get started. Thank you.
Okay, thanks, folks. Thanks very much, Soph, for the introduction, and thanks, folks, for being here, and thanks for everything that you do every single day and the hard work that you've been doing. I'm going to jump right in. I'll just note that my colleague, Kate Canizzo, who in normal times is the other half of the mighty team of two in AoE Communications, is on the call. She's going to be taking over for me as a response manager, which, as Soph noted, any day now. My wife and I will welcome a baby, so I'll be away for a few weeks, and Kate will be taking over, so you'll be in her capable hands. I also want to note, just reinforce that there is an email for questions that you should send to the extent that you as COVID coordinators or another individual, and I'll make this really clear, if your superintendent, whoever your superintendent designates to be the point of contact for your district, if that person can, to as much as possible, sort of pull in questions as we get educator questions, as we get questions from folks, if you can just sort of help us streamline that communication. We also have for each district, we have someone assigned to your school district. They've been reaching out to your superintendents today. Some of you may have spoken to some of them. I know they've been speaking to some COVID coordinators or to some school nurses. So that person will probably reach back out to you or to your superintendent. But to the extent that you can sort of organize and streamline those questions, that would be great. I should just also note that because of the peculiarities of us needing to get the testing scheduled in the short time frame, we're working in a place where we've been able to release some information, but we're working really hard to get additional information, resources, training, and other materials. So over the next few days, we're going to be working. The state has a holiday tomorrow, but we'll be doing some activities tomorrow, at least trying to get some messaging communicated out to you. And then we'll be working over the rest of the week to get the events scheduled and get them out into your hands so that the districts can start to get folks scheduled. So what I'll just note is to start from the top, The objective of the school testing, the primary objective is to do some public health surveillance of conditions in Vermont and across Vermont communities. That is the primary reason. We do see it as a great benefit from the AoE perspective to sort of see how conditions are in schools, how the conditions are among our staff and teacher population. But I should know that the primary reason for doing this and for doing it in the way that we're doing it is to get a picture into the whole geography of Vermont, because we have schools in all Vermont communities wherever people are. That's why we're choosing to use this avenue. So there's I'm going to restrict my comments to the first phase. There's essentially, you can think of this in two phases. There is a set of testing to occur next week. And then that is the entire state, all school districts. And then there is a set of testing to occur on a rotating basis through at least through the month of December. At this point, that's what we're focusing on. We're going to be potentially making a few changes. We're still working out the details for the testing there. What will happen with that round of testing is that we will test approximately a quarter of the school districts on a rotating basis. And the when and where your school district goes will be dependent in part on making sure we have geographic representation. So we're going to get a geographic sample each week, sort of by picking school districts strategically around the map of Vermont, so that we are able to capture a good picture each week of what's going on in our communities. But for now, for next week, which is what I'm going to focus on because that's the work that we need to get done now, we're going to be testing everyone. And I should note we're offering testing to Vermont teachers and school staff. The tests are voluntary. It is similar to the Department of Health pop-up if you attended one of those. The registration form is similar. The events are what they refer, like the technology side is what they refer to as a private event. So when your school district picks a day, we get you scheduled for a day for one or more events. They're going to, the health department is going to be working with our Agency of Digital Services colleagues, is going to be creating a private event for that, and your school district will receive that link. And then you will be able to, that link will be what teachers are able to, and school staff are able to sign up for. The timing of it is going to be somewhat dependent on the logistics. So there will probably be, like when you go to sign up to get tested, there will probably be a time. That time will probably be a default. It will depend on the decisions that you make in terms of the locations and how you get it set up and all of that. So you will probably need to be communicating with your staff population, your staff communities separately to tell them, okay, yes, it's going to be at this time or come to this room or whatever. I should just note we are working. We've been reaching out to all of the superintendents today. We're working to try and identify how many events are going to be held per each district. We're suggesting that people keep the number as low as possible based on factors like geography and other sort of necessary factors. We're here. Some school districts are doing one, some are doing multiple. The only real thing to note is that if you are going to be doing multiple in your district, you're going to need to make sure that there is a staff member available who can receive some training from the vendor who's working with the Department of Health in order to collect the samples. So with that, I'll move on to the sample collection. What is going to happen is after the teachers and staff register, the State of Vermont, the Emergency Operations Center, the medical logistics folks, the Vermont National Guard will very early in the morning of your appointed testing day, print labels and bring the test kits and the labels to one location in your school district that is pre-identified. If you're holding multiple events in your district, you will then be responsible as a district in moving the kits to the final location. You will then also be responsible for the test itself is a non-observable test. I believe I got that language right. I apologize, correct me if I'm wrong. So it doesn't require a healthcare practitioner to administer. My understanding is that they're fairly easy to take. And then, so those tests will be taken. The person will then put a label on it. The test will go into a box. And then the responsibility of the school district is going to be to package up those boxes, get them in the mail, overnight shipping to the Broad Institute. And we will provide specific instructions on how to do the shipping aspect of it. But it's very important that there can't be any, oh, we're going to hold a test overnight. They have to be, there's a clock running from the moment the labels are generated. So because the state is printing the labels, we'll be doing them first thing in the morning, very, very early, distributing them to your district. Your district will then conduct the tests over the day, need to get them, to UPS or to another provider by the time that they're accepting packages for them to go overnight to the Broad Institute. We're still working on some information, and we'll have some information along with a list of other resources. We'll have some training resources for those individuals who'll be running the testing. We'll have some resources for school staff in terms of what to expect. I should note, I'll just give you the high points now. Number one is this is a surveillance test, so there's no need to quarantine or anything like that. You should keep working as normal and go about your business as normal until you receive a call. If there's a positive test, the health department will treat like they treat any other positive test. I didn't say the magic words earlier, which is that these are PCR tests and not antigen tests. So they are those confirmatory hard positive tests for the health department. So if you are a positive, you will receive a call from a contact tracer, and they will do everything that they would do exactly the same as if you received a test in another venue or another location. That will also include the outbreak prevention and response team, and the school child health team at the health department will also start working if necessary as conditions warrant with the school district to do the response. If there's a case in the school, all of that sort of stuff will occur just the way it would with any other PCR test. But there's not going to be a data sharing situation in the employer. This is exactly like a health department test. The way I've been thinking about it, although my colleagues at the health department might not say this is exactly correct, but we're essentially going to be running a pop-up test. The state of Vermont will be running a pop-up test in your school on that day. Is the way you should think about it. So that's the basics of it. I'm just trying to make sure I haven't missed anything. What you should know about where we are right now is that we are trying to schedule all of the districts for a day next week. We have asterisks to give us dates that are absolutely not workable, and we're in the process of doing the assignments to allow us to meet the logistics challenges of this. So you will, and folks have been real good about giving us the dates that actually don't work, and if they have a preference, we're working as hard as we can to meet your preferences, but we can't make any promises. We're going to be sort of working from north to south throughout the week. So if you're a Southern Vermont district, you should expect, if at all possible, you'll be receiving tests later in the week. If you're a Northern Vermont district, you'll go earlier in the week. That's essentially the way we're working. For every school district except Monday, the school districts on Monday, the registration will close on noon of the day before. So you want to make sure that your staff are signing up by noon on the day before. There are no walk-ins. We will only give you enough tests for folks who are registered, and there's no way for a change or anything like that. That test is associated with you as a registered person. It can't be changed or swapped. Sorry, I just want to make sure that I have everything. The one thing to note is that for Monday, schools that are on Monday, and there are going to be fewer school districts, but we will be assigning some school districts on Monday. Those we're going to need, there's going to be a shorter registration timeline. Unfortunately, due to the logistical challenges, we're going to probably have a deadline for Friday at noon. And that's significantly, because folks won't have the weekend, that's a significantly shorter timeline for registration. We're going to make sure that those districts know by the end of the day, and that they are going to receive their registration links tomorrow, so that they're able to get the links out. Those will be a smaller number of districts in the Chittenden County area, Chittenden County and northern Champlain coast of Vermont. We've heard some real interesting ideas and thoughts where we're working with the health department to make sure that stuff is workable. For right now, the two things that I can share with you is that there's not a way to hold one event and then break the test kits out. If you're going to hold multiple events, you have to have a trained individual who is able to take the training. I believe the training is going to be in asynchronous, so it'll be a training module provided by the contractor, but you're going to need to be available at that location, able to supervise it and work through and be able to receive that training. There's no way to break them out and ship them to individual schools and then have them come back in. If you hold one event, it's going to be a big list of labels in alphabetical order. So we are recommending that you keep the number per your district as low as possible for logistical reasons, but we understand that folks may need to do more than one depending on the geographic location. The idea that we heard about today, which we think is awesome, and if it works logistically, the health department and folks are fine with it, you could run a mobile testing site if you wanted to. You could run an event and use a bus or another vehicle to move from location to location and collect. There would be there is a need for technology for Wi-Fi access and access to a website as part of running these events. So you would need to be able to log into the school Wi-Fi or use a hotspot or something if you're parked in the parking lot or something like that. But you could do a mobile site, and we know of one district that is considering that as an option. If you're going to do that, you'd probably still want to schedule events by each individual school, and that will just mean that the test kits will come to you with all the labels for the individual schools organized. But you could run a mobile collection system and have that one individual or team of people responsible for moving from school to school. That is all the information that I have sort of in a semi-organized fashion off the top of my head, but we'd be happy to take some questions. I just want to know that right now what we are burning to do as on the state side is to get the dates figured out and the logistical work figured out. So if we can't answer your question today, we're going to batch it, and then those communications will come to the superintendents. Now I understand I'm speaking to the group. We asked the superintendents to identify a contact person. I think in many cases you are those contact people. Going forward, all the emails will go to them, to the superintendent, and to them. Oh, and one thing I forgot to mention at the top of the call. So we are, as was noted on the press conference, we are offering this to Vermont school districts. This is a school district testing situation with a couple of independent schools involved. The decision as to which independent schools to include was made on the basis of their geographic location and their size. We are not offering testing at all independent school locations at this time.
I'm going to open up some questions here. Ted, thank you very much. I do know that we have tons of questions. So I'm going to get those pulled up on my screen and ask you some couple of things that I understand from what you were talking about is things that were important to us as the nurses. It's a PCR test. The individual administers it to themselves, and quarantine is not required because we're doing surveillance testing. These are not for symptomatic people. That person shouldn't be coming to school anyway that day. So, and everything has to happen in one day. So logistically, that's going to be interesting for those of us who don't have access to overnight mailing or shipping. That's something that we're going to have to definitely take into consideration, correct?
Correct. Yeah. So if you do not, if you're not set up to do, if you don't, are not set up with a relationship with a shipper directly, then they would need to be taken to a location, you know, a UPS store. The UPS is what the health department's been using. I'm waiting to hear the directions for shipping. There may be other carriers, but the only one I can affirmatively use is UPS, just because that's the one that's been told to me. So we'll have
Okay.
a sheet that'll have all that information. We're hoping to have that out at the end of the week, you know, Thursday or latest Friday, so you'll have some information ahead of time. Yeah, you would need to get it in. It needs to be in overnight shipping by the end of the day, by the acceptance time for your wherever your location that you'd be shipping from is.
Okay. Any idea how long it might take for, like, when people start registering, what is the registration time frame? What does that look like? Do you have any idea how long someone might need to actually be present for the test?
Sorry, so are you saying asking how long it takes to register for the test, or how long it takes to perform the test?
To perform the test.
I believe that the test should be pretty quick. It's a simple nasal swab, but we can lock down a better estimate. I don't want to say specifically, but I believe it's relatively easy. I'm sorry, there's a lot of noise background here, but it's what's referred to as a non-observable test, so it should be fairly simple
Okay.
to administer. We will have a full set of explanation on how to do it and all of that provided by the contractor.
Okay. So when you and I were talking earlier today, I'm up in the Northeast Kingdom and the schools are spread pretty far apart. So with this happening on a school day, if we're having one site, the expectation would be for teachers to come, teachers and staff who wanted to do this because it is optional. They would then come to wherever that event site is. That's one option, correct?
Yes, correct. If you're going to hold, a single event, then they're going to need to. That is Red, the unintentional star of many of my video calls here. Yes, if you're gonna the line that we've heard today, what we were able to confirm this afternoon from the health department, is that if you're going to hold an event, then folks will have to come to that location, which was where we got the bus idea from, as a sort of happy medium. If you're going to want to keep folks in building, and I understand there are, we're wanting to prevent congregation and all of that, then there needs to be multiple events. Those events are going to require someone who can receive that training. They need a login and some other logistical information. What I will note that won't change is no matter how many events you do in your district, you're only going to receive all the items to one location. The kits and the labels are only going to come to one location. So that will add some logistical complexity on your end, in terms of making sure that you get those to your various locations.
You also told me earlier that, or you mentioned earlier to all of us on this call, that potentially having someone move the testing supplies to the people, as long as we can keep all of that in the time frame that we're going to have to turn it around and get it mailed out. So that might be a little bit tricky for many of us. But I'm also wondering.
Could you rephrase that? I want to just make sure that I didn't say something wrong.
You want me to talk clearly? Well, I can't do that.
No, I just worried
Yes.
that I said it wrong the first time.
Okay.
Right.
So that each school district is being asked, is being provided with this, and they can offer it to the staff, teachers and staff, as an option for them. No one's required to participate, correct? That's number one. The school point person will identify the registration, the drop-off point, if you will, for the supplies and the mailing labels and the labels for the tests. And the turnaround time has to be done with enough time to get the final product in the mail so it can be shipped overnight. And it can only be on 1 day per district. Is that right?
In terms of in terms of the shipping out, that's something I believe we're still trying to answer as to whether or not you could ship from multiple locations. We're still trying to get that answered.
Okay. Let me move to the numerous questions that we have gathered. Oh, you keep talking about a bus. Do you know anything about the temperature location requirement? Can someone do this in their car? Can we set up outside and just have people come to the parking lot? You know, is it temperature sensitive? You may not know all of those questions, but.
Those are all really excellent questions that we will work to get answered. Because yeah, I think certainly having an outdoor testing location would probably be a good option, particularly for the congregation question.
Yeah, because that certainly is very, very concerning. Obviously, as you know, we've all been working very hard to keep COVID out of our school, and that also means we're keeping visitors and families outside of the school as well. Excuse me. Do you have the plan as you currently have it? Is that written so that you could share that with me and I can share that with the COVID coordinators? Or is that something we can expect in the next couple of days?
So we're gonna be communicating often with you and with individual superintendents and the points of contact that they identified. I'd be happy to share the information with you. We are asking that there be a person identified for each testing location. We'll start communicating with those people as well. We are still working out the details so that there's not a handbook, so to speak, that I can give you, but we'll certainly be communicating that. I want to say that we've asked the superintendents to identify the people, and we asked them for their COVID coordinator contact information. So you should be receiving that. My ask would be that if you're not receiving updates from us, check in with your superintendent and make sure that you were the one that was identified, because by this point, by the end of the day, our goal is that we will have established a direct conversation with every single superintendent and the heads of schools of the independent schools that are participating, and so that they can reach out specifically to the person who's working with them and make sure that you're added to the email list and all of that. So we just ask that you work with your soups, through your soups, try and keep you just want to make sure that the number of emails flying around and the potential failure points are reduced as much as possible.
We want to make it work too. And I think that many of the questions and responses that I was getting this morning was there's not enough time to lay this out there and have it be organized and effective and helpful. So, and I can appreciate as well, we have 60 people on this call, so that's a pretty quick turnaround for folks to be able to, and I appreciate all of you joining and the questions that you have been raising. A couple of questions come up, and you already answered my question about how do we get it overnight mailed. So hopefully we'll get some additional information about that in the upcoming days. What about the schools that are remote? Would you be asking teachers, and again, it's all optional, so would we be asking teachers and staff to come to whatever location that COVID coordinator identifies if they want to be tested?
So you're saying if the school is remote, we have a question into the health department about a potential alternative on this, but as we stand right now, someone does have to arrive at the location for the testing to occur. We're trying to, excuse me one second, I'm just gonna put him out.
Thank you for the questions in the chat. And I will certainly pose some of these additional questions to Ted. I think also we can capture these questions and share them with Ted and Kate, because I know that many of our questions are going to help plan how this is going to go. And we all know that we're the best support for each other. So we have great creativity and ability, but it's a little daunting at this point.
So could we plan to have another meeting after we know more, like maybe on even tomorrow or Thursday, just to circle the wagons?
It's a great idea. I don't know how quickly we're going to have that additional information, but we certainly have discussed that as the executive committee this morning. So I think we can look at that and try to get as much information as possible so that we could then speak to answering those questions and helping identify how to set things up. I'm thinking we need to communicate somehow to the staff how this is going to work.
So if I have a question, we know that COVID transmission within schools is minimal. So why would we as a state want to test all of our staff and put us at risk of having to close schools? It just seems counterproductive to me.
So that's a great question, Christy. And
I can answer that.
Yeah, thank you, Ted.
So no worries. So I just want to be clear, and our messaging to superintendents was pretty clear on this. And the Dr. Levine's messaging today was, this is not a reflection on the safety of the school environment at all. As a matter of fact, and I know, and I don't want to undersell the fact that it is useful for us from the folks who are focused on the school health and safety side of things, that it is you know, it will be of value, but the real driving purpose behind this is actually the location of schools and their geographic dispersal. I hate to put it in such direct terms, but y'all are a good audience, an organized audience that we can reach with relative ease by comparison to trying to test other similarly dispersed populations. My apologies for my cat.
I just think that it's going to cause a lot of angst and chaos within the communities. And you already have parents who are nervous to send their students to school, even though we've provided them with all of this information on how safe it is. And the first time that they hear about this random testing and a staff member coming up positive, I think there's going to be a lot of backlash, and it's going to be in the media.
It's great to be upfront about those concerns. I think this is like the testing that currently occurs in Department of Corrections and long-term care. It's a way of monitoring public health, as the surveillance is the word. It's not looking for problems.
I should note, and I'll just say that I totally recognize the concern. The view, and I don't want to speak for Dr. Levine and my lovely and amazing colleagues at the Department of Health, but for the view of our view is that there's no such thing as too much testing. Really, this is an opportunity to find asymptomatic cases, to find transmission that we might not otherwise find, to get an understanding of. We do know from the data in the recent weeks that the uptick in Vermont is significant. We are still doing better than many other states in the country, but that doesn't mean that things haven't changed radically from several months ago. And that's not due to anything specific to schools at all. It's just the reality of sort of the community situation for us all. So this is an opportunity for us to gather some data, to get a jump on some contact tracing, and to better understand the trends and what's going on in the communities. And we are totally messaging that on our end. We'll be providing that sort of information to you, that you can. We're working on a sheet, and I've been working hard with the Department of Health to make sure that there's some information you can hand out either physically or via email to folks in your testing population. And I will just note that the testing is entirely voluntary, and also that the follow-up testing is entirely voluntary. We're not going to be doing one test now and then following up in a few weeks to test. They will be entirely voluntary. Folks can do both. We hope folks will do both. They can choose one or the other. They can do one now and then not do one. The intent is really to just get a picture of what's going on in each of your individual communities.
Ted, I want to thank you again for that. I just want to remind everybody that this testing, it's not a question of whether or not we're going to do it. The decision has been made by the governor, and the AoE is working to, we're basically the people in the schools, those of us that work in the schools in Vermont are essentially a captive audience. And as Ted said, we represent, through the schools, we represent all around the state. So it's another mechanism for community surveillance. And Ted, I appreciate the answers that you've given us. And I know that we have tons more questions as well. But I'm wondering what at this point would be beneficial. How could the COVID coordinators help you at the AoE move forward with this?
So certainly, it would be really awesome to get the questions from the chat. We have I was just trying to count up the number of bullets of questions. We have a large batch of questions that we got from speaking to superintendents and COVID coordinators earlier. I saw a couple of chats go by where folks were mentioning that they hadn't received an answer yet. We appreciate that. We've shared those with our colleagues at the health department. We are working on answers. Our message, our follow-up messaging on this will be developed in part and shaped by that. We'll also be providing you with the resources that I mentioned above, as well as the information about the training that you need to complete. And the team, the IT team, will be also setting up folks in the system for the registering and providing folks resources on how to use that. So any questions you have, if you could really help on your side coordinate additional follow-up questions and either connect through the case person who's reached out to you and spoke to you today or spoke to your superintendent, or through the AoE COVID testing email, which we'll make sure that we share in the chat, and also have on hand for Soph to share with folks. Please use that as much as possible. If you can receive questions from staff and funnel them through to us, that would probably also help. Also, just know that we are working as quickly as we can to get this organized and scheduled. Every time I do a logistics mission for the state, I think I've seen it all. But no, this is the largest number of tests that we're going to be running in any specific individual program so far. The health department's pop-up testing clinic will have done more, but through many individual clinics. But this is, I think, the largest go so far. We have in our universe of potential testees, we have 25,000 people. So that's a really good number. So it's a big logistical undertaking on our side. We're working as quickly as we can to get more information out to you. Reach out to your superintendent and check in with them. Make sure that the information that they're hearing from, make sure that they've shared people, make sure that if you're going to be doing multiple locations, that you have those staff members identified and trained. We really need to make sure that those people are trained and available on the day so that they can manage that testing in those districts. I think that's pretty much it. I'll ask if my colleague Kate has any other things to add. But if not, I think that's pretty much what we need, and we're just working as quickly as we can. So I understand, and just want to thank you again for your patience, because we would like to have more of the details to share with you up front. So we're confident that a lot of the questions will get answered as we work through setting up the structure and the testing and all of that.
So we're very appreciative of that, and very appreciative of the time that you have given, because I know I wasn't the only person that called you. What the heck is going on? So the people on this call, we do have a list of the COVID coordinators. And I know that one thing I'd like to do, Ted, is share that list with you and Kate. So maybe you can cross-check it. But the COVID coordinators would be very helpful if we got the information at the same time as the superintendents around this particular thing. It just takes one more step out of the very short time frame to turn this all around, and I think that would be helpful for the COVID coordinators. And I just don't want anything to get missed. And I know we're all super busy, so if we can have additional stopgaps, that would be helpful as well. While you were away with your cat, it was asked if we could do this again when we have more answers. So I'm not asking you to agree to that. I'm just saying that that was a question that was posed, and we at the VSSNA will certainly coordinate that if we're able to do so, as well as forwarding questions to you. Because I just feel like that's the best way to get the answers, is put them in, send you the questions as they have come to us, and find out how we can get those answered. And then the information sheet is certainly going to be helpful. Some of the questions that have popped up in the chat are things like, when is the training going to occur? How many people need to be trained? What PPE is required? You've said it was not observable and the people can do it themselves, but there must be some sort of mini training session, information session that each person that's coordinating each testing site must have to be able to share, to make sure somebody's doing it right.
So it is a non-observable test, and I'll be honest with you, I don't know what that means. If I had an example of the instructional materials as well as the training materials for the person running the site in my hands right now, I would share them with you. I do not yet. That is something. This project is being done in partnership with a contractor that the health department has contracted with. So we are still waiting on some materials from them. As soon as we have them, you guys will get them. I imagine that those will answer most of the questions, but if they don't, we'll work to get answers for them. Yeah, they are non-observable, so they should be self-administered. You should be handing a tube to someone and they should be going away. My understanding is that we'll have detailed instructions for folks, not for the administrators of the test, but for the person actually self-testing themselves to follow.
Okay.
Like I said, I don't have that today, but as soon as we do have it, it'll be in your hands.
Okay.
So,
Appreciate
and
that.
we'd be happy to check in later in the week with you in terms of a follow-up meeting. We'll just have to see over the next 24 to 48 hours how quickly things get the information gets worked out and out to you. I would suggest that if folks have questions, don't hold them back. Don't wait for another meeting. It would be nice for us to get those in advance, and we'll be able to already start working. We're getting a lot of very similar questions, which I think is a good thing. It means we know what resources we have to provide out there. But if you do have a question, don't assume that somebody else has already asked it. Just keep on sending them through, and we'll do our best to answer them as they come.
Great, I appreciate that. Is it safe to say that the dates we are looking for scheduling for the majority of us will be Tuesday, Wednesday, Thursday, Friday of next week?
That's correct. In all likelihood, it's coming in fairly evenly. So a smaller number will go on Monday, and we'll be extra communicative with those districts to make sure that they have what they need, so that they'll be ready to go first thing on Monday. We'll also be simultaneously on the other side that the state team is working on making sure that they have all the logistics ready for Monday. And then Tuesday, Wednesday, and Thursday, like I said, it'll sort of go down the state. So if you're in the Kingdom, you can expect probably to go on Tuesday or Wednesday. If you're in Southern Vermont, it'll probably be Wednesday and Thursday. And like I said, we're doing our best to take into account folks' preferences. We did ask for folks to give us red light days. So that'll change a little bit, but we're trying to prevent us sending guard trucks to every corner of the state every single day next week. So we're doing as much as possible. We're streamlining the logistics. So that's as much of an expectation as I can give you right now. But probably within 24 hours, your districts will start to learn what day you're going to be scheduled for.
Okay, that'll be helpful as well. I don't know if you mentioned this earlier, but what you just stated is these tests and labels are going to be distributed to the schools by the Vermont National Guard. That's a question many of us have had. How am I getting this stuff? That's how we're getting this stuff.
And I'm not going to guarantee it, but in a lot of cases, the resources, so the PPE kits, the cloth face coverings and stuff, it's a partnership between the Vermont National Guard, the Vermont Department of Health, and the Vermont Agency of Transportation. They're the logistical backbone, and they do an amazing job there. They're really, really wonderful. So I can't promise you that the Guard will be bringing them, but we do have a group of folks who are standing up to show up as early as possible. We have gotten, I don't think this question was answered. We have gotten a lot of questions about when exactly, and that's going to vary by school district. The answer is as early as we can. These folks are going to be starting their day. They're going to be departing the warehouse at 5 o'clock in the morning, but it'll be dependent on your location a little bit, but we'll do our best to give you an understanding of when that might happen and when those tests may arrive.
Thank you. That is most appreciated. So we have lots of questions and we have some answers, and it sounds like we have a direct conduit, which I appreciate very much, for getting answers over the next couple of days. And Becca, is there a question that I missed?
I don't think so.
Okay.
I mean, there are a lot of questions, but I think that we've captured them in the chat. We have a direct route via TED and the email to get the answers that we need. And we're going to share the COVID coordinators list with TED, so for cross-referencing. And I think that we just need to, as COVID coordinators, stay connected. And if you guys have questions, please email covid-19@VSSNA, and we'll do our best to help coordinate communication.
Thanks.
And I'm sorry, Ted, this is Clayton Wetzel. I just want to make sure I've been recording this, and I wanted to make sure that you're okay. I was going to share this video once I upload it to the VSSNA. I can do a YouTube channel, but get it to the superintendent so they have what was spoken here, because they might not have been able to be on the call, and it would be good for them to hear exactly what you were talking about. Is that going to be okay? You're muted.
Sorry about that.
Yep, that's
Yes,
okay.
that would be fine. We will also we'll be continually talking to them, and they can reach out to us. And I'll just say in general, you know, if you've been in contact with your person from AoE who's called you, just keep reaching out to them if you have questions, or send general questions to the AoE COVID-19 testing box.
Terrific. Thank
I
you
will say,
very
I
much.
just saw a question from Arlene Scott. Does the COVID coordinator need to be on site from the clinics? That not necessarily, but the person who receives the training will need to be on site and to check people in and get the labeling and all of that. So, and we will have details of what exactly those tasks look like as soon as possible.
Okay, that'll be helpful. For example, I'm not sure if I should try to set up 2 sites in my own district because it's so spread far apart. And we're asking for the registration now, but I don't even know how many people I need to.
Yeah,
up
I
and running.
should just be clear with folks. In most cases, the decisions about locations have been made, and we would urge that you do so this evening. If not, so if your district has not done so, connect with your superintendents. Most have. There might be some opportunity to change sort of midstream, but we need to lock those down. Otherwise, we can't create the events and can't get
Right,
folks registering.
right.
So that is, I would say, if that's something you're still trying to work out internally, that's the biggest time pressure. We have been able to contact most superintendents. We're going to be reaching out to a few more to make sure that we close the loop with everyone. I saw someone ask, when can we expect to hear from a person at AoE? Your superintendent or your head of school should have heard from them already and received a voicemail if they didn't manage to speak to them the first touch.
Thank you. I just want to remind everybody, it sounded like from my discussions with Ted over the course of the day, that the training is not going to be face-to-face. It's a video session that we can watch on our own and ask questions about, I believe. As soon as those details are available, I know that we will share those.
I believe I don't want to say definitively because we are still waiting to receive the information, but we should. I believe it's one of these asynchronous sort of set of slide decks and potentially some videos. I believe that's what it's going to be, but we'll make sure that as soon as we get it, we'll just send it on to you.
Okay. We are closing in on 4:30, and I want to thank you very much for your time. So this is recorded, and we'll capture all the questions in the chat and forward those to you as well. I have a question from Clayton. Should we try to schedule tentatively tomorrow at 3:30? If you can use your little hands to raise your hand if you would like to do that, the little hand down at the
To get to the hand, you have to click on participants, and then there's a button that says raise hand.
I'm going to take that as yeah. So I'll set up a Zoom for tomorrow, Ted, and I can invite all of the same folks we invited today. If you need to be on the call, that would be, then you'll have the link. If there's, so I'm not sure exactly what this would be on the schedule for tomorrow, but we'll have that pinpointed for 1 hour again tomorrow for updates or whatever. I'll get that out tonight.
Thank you, Clayton. I appreciate that. So keep sending the questions to the AoE COVID testing question email and to VSSNA email as well. And we'll see you all tomorrow. And
Can I clarify a question that just came up in the chat of who the meeting tomorrow is for? Is it for staff? Is it for COVID coordinators? Whom is it for?
It would be for, to me, COVID coordinators. And then we would have the VDH liaisons on there. the AoE folks, if they need to be on there, if there's more to add, they would have time to do that. Did I miss someone? I think that would be the key players. That was my thought.
So no staff at this time. And if you'd like to invite your superintendent, you certainly could do that.
Okay. Thank you all very much. Know that we're all in this together, and we all have the same questions that you had, and that's, again, Ted, I am so appreciative of your willingness to share what you do know and support us in that way. It really means a lot in this time of uncertainty. We appreciate the effort that you've made to share with us what you do know and what you don't know. I appreciate that very much.
I'll just say on behalf of all of our state partners, because I think we've got, well, I could spend a while listing all of them, but we got at least 4 agencies on board here now doing this work, not to mention all the folks who'll be just doing the distribution. Thank you all for doing this. I recognize it's a big lift and a short turnaround, particularly for this first week. We do think it's really valuable, otherwise we wouldn't be doing it. So we really appreciate you guys making it work and figuring out the nitty-gritty details on the ground. And we appreciate everything you do to keep students and staff and Vermonters safe. So thank you all.
Thank you. All right, everybody, take a deep breath, go home, get some dinner, relax. We'll see you tomorrow afternoon. Thanks for